Ok, transmitiendo en vivo.
Okay, so good morning, good afternoon, good evening, everyone, depending where in the world you are. So we are right now in the workshop that we call Health Without Hospitals. So the topic of our workshop that we decided from the Andorra City Science Lab was because, well, it's been a topic that we have been dealing in the last year's month, but now in the context of the COVID-19, so it's especially relevant, not only here, but also in the world. And this is why we decided to talk about how digitalization, how digital transformation of health could help us worldwide to design or to change the healthcare systems to be more efficient, more sustainable, more resilient. And this is a little bit the topic that we would like to discuss in this workshop. So today we will start with some short presentations that will give us some context about the topic. So Jordi Serrano will give us this context about future challenges of health and especially how digitalization, digital tools could help us. Then Vanessa from the Andorra Innovation Hub will talk a little bit an example of how in the context of COVID, we could deal thanks to digitalization to fast give response without or out to the conventional classical infrastructure of healthcare systems to give response to a crisis like the COVID. Then Dr. Eva Eras will explain us about the aptitude program that is an project with a high component of technology in order to tackle with the aging, with the topic of the aging. And finally, Oscar Chamat from Cities for Global Health will explain a little bit close a little bit about this topic. And finally, after this context, we will have a little bit a discussion in groups about the challenges and opportunities of digitalizations in health, and finally to have a joint discussion and conclusion. So just to start, I will introduce, well, Jordi Serrano will introduce herself and start with this introduction and context of the topic. Please, Jordi, the floor is yours.
Thank you very much, Mark, for the introduction. It's a pleasure to be with all of you today. We thank a lot for the invitation to Jorge and the rest of the colleagues. And let me share my screen. Just one moment. Okay, basically, I want to explain a little bit what are the tendencies of digital health, which right now is an explosive tsunami movement, no? That of course everybody's requiring. And obviously we are talking from Andorra. I'm saying that everything you can have for the future of digital health, not only Andorra, of course, we have to be humble, but this is a place where things are changing very quickly, where population is really taking seriously the COVID issue, and where the opportunities can really change, transform the healthcare system as in many other parts of the world. Very quickly, I'm Dr. Jordi Serrano. I'm a medical entrepreneur, GP, family doctor, and right now I'm advising the Servei Andorra de Salut, which is the Andorran healthcare system, trying to move forward what later Vanessa, Eva, and finally Mark also with the late summary will try to explain you about Andorra. And also I've been advising WHO for some years. My company, Universal Data, has been developing tools in more than 20 countries around the world, digital global health tools in that sense. Basically, Andorra, for those that don't know, it's a small country in between Spain and France, in the Pyrenees, with a small population, but a very active one, and of course, around 8 to 10 million of tourist visits in that sense. This is a graphic I like to just to show to everybody in lately in my presentation. This is a graphic that right now it's a little bit old already. It's from 2018. It was just a graphic developed by GPs and cardiologists in the United States during a weekend in a conference, just to gather and just to summarize the bombardment of buzzwords that they used to get, to listen and what is that about. And they did just some assessments about how many of these doctors in the room could really describe most of these of these basic words. No, it was difficult. There are some logical and simple words, but there are other words that many of the GPs, cardiologists, many of the doctors that right now are practicing, they have no idea about. No, all this conjunction of things about digital health, big data, precision health are going to transform healthcare totally. And if you say what has to do a mobile phone with micro RNA, or what has to do microfluidics, so everything has to do with everything. And that's why the exponential transformation will be enormous in that sense. If you remember the quantified self movement like 20 years ago or 15 years ago, it looked like that it was the most advanced issue at the time. And after some years, it went down. And right now, with all the wearables and all the body wearables, I like to say, not all the things that, because at the end, it will be our body, or clinical health history or personal health record will be our own body soon. And that is transforming everything, will transform everything. Words like digital therapeutics, I don't know if some of you have heard of them, are transforming the issues. Yesterday, the federal government, German government, approved a new law that will allow physicians prescribe digital therapeutics, which is a software that has been validated with a randomized control trial. So right now, these softwares are becoming pills in that sense. I've been lucky to be a part of a group that has been request to try to write a document to try to transform healthcare system in Catalonia. This is the region neighboring Andorra. And we had a white paper to start thinking on it. And basically, the most important conclusion that the document tried to explain to politicians was that what is very important is to decentralize healthcare from hospital to primary care centers, and from primary care centers to homes. And in that sense, there are a couple of technologies that are super, super important. No? And both of them have to do with voice or with with ultrasound. No? Ultrasound and voice will really change the healthcare system as we know it now. Yesterday also, and it's nice to have that this news, a company called Butterfly Networks, sorry, it's an American company that will really democratize healthcare, finally launch a new version of Butterfly Network, which is an ultrasound that really has a cost of $2,000 per device, and where you have all the images on the cloud. This is something that will really democratize the healthcare, because we don't want GPs sending people to hospital. We want GPs going to homes and from there making explorations and so on. And anybody in the middle of any country, even if there are no installations, can use these devices and really send information and to be diagnosed in another place, for example. Chatbots with voice recognition, chatbots that allow to control any symptomatic disease like heart failure or other diseases will be the normal procedure within the homes of many healthcare people, older people, sorry, in many healthcare systems. There are some companies that have developed algorithms that really take care of people with heart failure. And we know already with the voice, we know already with many other symptoms detected by the voice recognition and other instruments that this person is going to be in the hospital in a couple of 3 days. So we can avoid that. Also, very quick comment about artificial intelligence. It's very important to understand that artificial intelligence will be over all the diagnosis systems, all the things that have to do. And it's very important to break it down in machine learning, natural language processing, because sometimes people have a big mess on their heads. And basically, we know that we can use artificial intelligence through, for example, natural language processing, collecting all the information with the clinical histories and transforming in a structure to an structure information, for example, to increase the number of the recruitment of people for clinical trials. That is very expensive and has been done in many European hospitals now. In Spain, for example, we have a company called IOMED, where it helps many pharma companies to increase the recruitment of the clinical trials, which is something very costly. And it's just using natural language processing and making the clinical histories structured instead of unstructured text. This is very important, and I think it's very important that the conversation between engineers, architects, software architects, and doctors can really be more simple. And sometimes doctors don't know what is a CNN, a convoluted network. Doctors don't know these things, but once they understand all these terminologies, it's so easy to have a conversation and to advance in that sense with the solutions. Very important also, the topic of digital therapeutics. As I said before, it's been advancing every month. And right now we have some solutions that can be really used as a drug. We'll come that later now in a couple of minutes. Yesterday also, no, before yesterday, sorry. One of the biggest companies in the world, Bupa, with its filial in Spain, Sanitas, they launched something called the Digital Hospital. As you see, this is a video diagnosed tool using plethysmography, like the one that we're using with pulsimeters, to have with the video camera all these constants measure blood pressure, oxygen saturation, and this comes from an Israeli company, and this will transform healthcare totally also, no? Because the number of measurements that will be safe will be incredibly huge. As I said before, yesterday, the German government just passed the law to certify that physicians can prescribe software in that sense. And what is here in the corner? Many things, but just to make a summary of what we want to achieve. We want to achieve what is called the digital care delivery as a full system that can be very important to implement in hospitals, but with a lot of coordination with municipalities, with different types of healthcare institutions, depending on the continent, which are very different. But basically, what we call the digital care platform, it's a summary of the interoperability of all the systems that include remote monitoring, precision medicine used by the own patient, and so on, and all type of electronic health records, telehealth, open notes movement that is very well known in the States. Everything together, no, will be what we call the digital care delivery, and that will be something where the healthcare governments, the institutions, will be there using that digital care delivery system, but also the patients will be very involved. Just an example of how the Israeli ecosystem has put very quickly all these solutions to combat COVID, having already into account all these, what we call the digital care delivery platforms and so on. So each of these companies are working in having in mind how all these other companies are also delivering the solutions to try to connect between each other. Just to finalize all these tendencies, for example, in Holland, we have this MedMich project, which is basically the government or the institutions supported by the government, patient association, municipalities, it's very important in this topic today, have developed a stamp that recognize any application that empowers patients and that allows patients to interoperate with the healthcare system of their own city. That is very important with what we call FHIA or HL7 technology. And this is the way to allow innovation from one side to advance and patients be involved in the healthcare system itself. This is a very interesting project. Anybody interested? It's called MedNiche project, and it's very interesting. Finally, there are many cooperatives in Europe, like the one in Barcelona called Saluscop, that what they are trying to do is to enhance, empower patients to have their own data, really, that the patients own their own data. In theory, it's true. In practice, as you all know, it's very difficult. In Germany, the same concept, my health, my data, it's been implemented in many cities. And also some of the things that in Andorra, we are looking at and other potential here in the neighbor, France, a nice company called Pascal has developed a personal health record, a real personal health record that was discovered by Dr. Eva Eres, that later we'll talk to you, and many things that are right now changing the potentiality of the system. 30 seconds. Andorra has been fighting a lot in the last months, and now my colleagues will start to explain different solutions. But basically, Andorra developed a web app system to collect symptoms, developed an amazing, that Eva will explain later, system to cope and to manage, to track elder people, is developing that system, and also a brilliant serological survey that will be explained by Vanessa now. And it's been a pleasure to be with you. And thank you very much. And it will be a pleasure to answer questions and to coordinate later the part of the groups if you are in the conversation. Thank you very much.
In terms to help to improve the healthcare systems, but also it poses quite a lot of risk and challenges. And also how, in terms of opportunity, the digitalization and this innovation could help us to deal with this digital divide that we have, not only big cities, but also, of course, in more significant way in big cities and informal places. That is one of the topic of main research of the City Science network. That is how we deal to redesign or in these non-formal places in cities. So these are a little bit to risk and one opportunity that we think and that we wanted to discuss. And also the other one was more related to how we engage patients, doctors, the different stakeholders in this new paradigm about digitalization and innovation in the healthcare system. I think the other one will leave it today. So maybe if you want, you can send us in the chat some questions for the speakers first, if you want, and we will start to deal with the different speakers. Stop sharing. I don't know. No question in the audience?
Marcus wants to say something, I think. Marcus.
Yeah, I have a question. Thank you very much, everyone, about kind of a unified platform. Is there an emerging platform that would allow kind of the integration of a lot of different data sources, to kind of be overlaid? I think that's one of the biggest challenges that I'm seeing in healthcare systems, where there's a lot of data collected on multiple venues, but there's very little way of correlating it to find emergent, phenomenon or whatever in populations. And I'm wondering if you guys see that there's a strong trend that one should just kind of start looking at in the industry? Thank you.
It's me, for that.
I would say,
I think so. That would be, I know that between your work and Ronan's work, I mean, Ronan was working with telecom data, which is one, but that was overlaying that with other, findings from testing. But
the silo, in healthcare, we're still in the silo era. Although obviously we could say Paleolithic or silo era. Maybe in the future they will look back to us saying that was the silo era, because there's a lot of blah blah blah. But at the end, the typical data lake that in other industries you would say, okay, have here that data lake with all this data. At least in Europe, for obvious reasons, for GDPR, for many other obstacles, for the typical silo structure, you have a hospital in front of another. They don't share the obviously the electronic health record. Governments have done step forward, integrating things with good interoperability, but sometimes what you have integrated is a minimal database, that it's not the huge data lake that you could have. So in that sense, it's a huge potentiality in healthcare. At least in Europe, we will have to be very innovative to bypass regulations. And I foresee that, for example, what it's called more collective intelligence, because there's artificial intelligence, but then of course, you have, at the end of the day, still data. If you transform that in a vectorial, what is called knowledge, then regulation allows to share knowledge between institutions, no? So right. There's some nice technologies that it's called collective intelligence, that we're doing is transforming this data in vectorial knowledge. That I see a huge potential, because until now, politicians have not thought of regulation to stop that. So I would stop here in that sense.
Yeah. So that's a little bit about the experience, Jordi, that we, in fact, is one of the topics that we have decided project that really go to this digitalization, or to really create this digital data platform to improve the digital health. And one of the topics was with Jordi and some colleagues, okay, is there any platform, is there any standard that we could start to build it? And what we found is, not in Europe and everywhere, we found that most of the healthcare systems are still in closed lock infrastructures and software tools, that they are not thought about this philosophy. They are at a closed health record system, so on, and that we really thought that we are still in a point that we still have to decide how really can open these closed systems in an open way to really make these connections to the citizens, to the EI, so on. And this is what we found here, but doing a benchmark and talking with a lot of people, it's more or less the point that many hospitals and many places are. Some of them are a little bit more ahead, that they already have this kind of middleware, converting what is the medical history records to a way that you can explore, play, and go further. But yeah, this is, I think, one point, at least in our environment, that still in this point of try to talk everyone in the same language, in the same standards. And also I would add that we are still in the point that we have still to define several standards in terms of how we deal with personal data, how we deal with the identity of the people going to how is the owner, the hospital, the citizen. So I think still there are many questions yet in order to have a really standard, not even platform, but still standard of how we build platforms that I think that for sure the context that we are in terms of the pandemic and crisis will accelerate to look for this kind of standard that would help us to build this kind of platforms, for sure.
Right. It seems to me like if we can define metrics that are relevant, that would make it easy to create these kind of vectors of information so that you could extract at the database, whoever's collecting it, the useful information that then could be put into a larger civic data pool. And that I think would be a interesting challenge.
The problem is that there's still poor amount of data. Many data has not been collected correctly, and a lot of data put by patients in the last year would overpass the current data. No, and I myself, I'm asthmatic. If I go once a year to see my pneumologist, he would call me once a day. But if I send my data where I have been walking with the ozone, with the NO2 of the atmosphere, that's an example, no? So it will change totally. But right now, hospitals and governments are starting to listen to that, and very soon it will change everything. Eh? It will change everything. So
I would like to talk about it because my previous job, I was designing bike infrastructures for the Barcelona City Council. And we face the opportunity to collect a lot of data, how the people is moving here in the city. But I mentioned Barcelona, but I know that I'm totally sure that is happening in many cities worldwide, that the municipalities do not have the capacity to manage this amount of data, neither the technology. Probably they have the intention or the idea to work with all this data, but most of the times they don't have the technical, neither the political capacities to manage all the data. So there is not only technological issues here, but very human resources issue to talk about it here.
We have one question that I read it actually. Is what about privately collected data from companies? For example, I have constantly recording EKG implanted inside of me. Medtronic owns it. So every night they upload the data from each of my heartbeats to their cloud. Cloud governments or institutions gather data anonymously so that the one could add the data to see things like an increase of heart rate over time can demonstrate a fever in a patient or gather data in fighting COVID. Is it possible to combine private patient data with public through anonymization? Yeah, that's exactly one of the points that we wanted to raise in this discussion is about how we'll deal or how we tackle with this balance with privacy of data, but is shared to the collective knowledge for the systems or for the healthcare environment.
And also there are different regulations. The regulation here in Europe is different than in other countries or the United States. So sometimes the data belongs, well, Jordi, he can add information about this, but sometimes the data belongs to the people who are developing the medical device. And in other regulations, that's not like this. It's your own data, and then they don't have the rights to share, to do things with them without asking you. So this is a big challenge, of course. So
no,